Bismillahirrahmanirrahim. We made previous video about the percentages related to 0 to 10%. Means all the incidences were of 0 to 10%, and you can watch the videos of that. And now in this video, we will discuss or we will talk about 10 to 20% cases. And I have collected all these cases just for the SCPS Part 2 MCQ exams, the OBS and Gynae MCQ exam, because in the OBS and Gynae books and guidelines, there are different percentages related to 10 to 20%, and it would be better if we compile all these percentages separately so that you can memorize it in a better way. Okay, so let's start our video. Okay, the first is that of the likelihood of malignant changes in complete mode. Okay, that is 15%. Okay, at this point it would be better if we do a comparison with the likelihood of malignant changes in the partial mode, that is 1%. We discussed it in the previous video, so you have to remember the malignant changes likelihood as well. Now, percentage variant of the von Willebrand disease, that is 13 to 18%. Okay, so this is the percentage between the 10 to 18%. The previous percentage, that is the likelihood of malignant change in complete mode was 15%. That is also in the range of 10 to 20%, and this percentage is also in the range of the 10 to 20%. Now the third one is that of the risk of recurrence of the recurrence of the pyelonephritis, that is 10 to 19%. Okay, you can also see that this percentage is also between 10 to 19%. Okay, whenever you memorize some important thing for exam, it is very good practice to revise the previous things along with that as well, so that important points sit in your mind in a proper way. Like we are saying that risk of recurrence of the pyelonephritis 10 to 19%. Okay, so also remember like that in previous video we discussed the risk of the asymptomatic bacteria, that was 4 to 7%. Okay, risk of now another percentage is that of the percentage of the people developing bacteriuria with the pyelonephritis. Okay, that is 15 to 25%. Okay, asymptomatic bacteriuria risk in pregnancy is that of the 4 to 7%, but here the percentage of people developing bacteriuria with the pyelonephritis here also, although this 25% is going beyond 20% range, but I have also included it in this video because it starts from 15%. So on the average it is 20%. Okay, 15 to 25% averages, that is 20%. That's why I have included it in this video. Okay, so percentage of people developing bacteriuria with the pyelonephritis, that is about the 15 to 25%. Now, percentage of pregnancy related deaths caused by infection, 11% deaths are caused. Okay, so that is also in the range of 10 to 20%. So we have to remember at this point. Okay, now another percentage, risk of abnormal uterine bleeding with von Willebrand disease. How much is that? It is also in the range of 10 to 20%. Okay, so that is 13 to 16%. Okay, you can check it from the guideline as well, and all these percentages are basically from very authentic sources, and although some variations comes along with the time when the new guideline come or whenever some addition is in the book, but up to date these guidelines are correct. Okay, now incidence of the meconium aspiration syndrome, that is 10 to 15%. Okay, now it's very important to compare it with the other 2 points, that is meconium passage in the post-date is 30% and meconium aspiration in the post-term is 50%. Now, what is the incidence of the chronic pelvic pain in women of reproductive age group? That is 15 to 25%. Okay, now this percentage is also a little bit going beyond 20%, but I have included it here because the average is that of the 20%. Okay, so overall we have studied 2 percentages in the 15 to 25% ranges, that is percentage of people developing bacteriuria with the pyelonephritis, that is 15 to 25%, and here incidence of the chronic pelvic pain in women of reproductive age group is that is 15 to 25%. Okay, so thank you so much for your patience. I have added few of these percentages for your better understanding, and it would be better if you do comparison with the previous videos so that you can memorize them in a very better way.